The flu kind of incubates from anywhere from 1 to 4 days. And in the early part of that incubation period, you may not have symptoms. And actually, because the virus does not replicate as much early on, you may actually test negative even though you have contracted the virus.
Welcome to Baptist Health Talk, a podcast on all things healthcare powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
Hi, I'm your host, Sandra Peebles. Welcome back to another episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're talking about the flu, but here's the thing. The flu doesn't feel quite the same as it did 5 years ago. Why is that? What's changed? What does this new era of viral awareness mean for our health? Joining us today to answer all those questions and more is Dr. David Mishkin, Medical Director of Virtual Urgent Care and Urgent Care Express at Baptist Health. Thank you so much for being here.
Thank you. Glad to be here today.
So, Dr. Mishkin, it feels like more than ever, people are saying that the flu is hitting harder. Is that the case? Or is it that our perception of everything has changed after the pandemic?
You know, the flu has a lot of variability in how severe it can be. And I think a lot of that still exists. When people do get the flu, they can potentially feel extremely ill. And so very often it depends on, what are the more dominant strains out in the community? And also it has a lot to do with the patient themselves. Are they someone who has other types of medical problems? What is their age? And eventually, have they had the flu before and how's this time different?
How have behaviors changed after COVID? Have things shifted for people, or are they taking it more seriously? Are they just more casual about it?
We do see that people are more in tune to a respiratory illness since COVID than they were in the past. There's a lot of patients that I see and we see in our health system that is very much, looking to come to get care for things that maybe in the past they wouldn't. There is definitely a culture now that really, favors testing. So very often, not that the viruses or, have changed, but the desire for the patient themselves to want to know what they have has changed very much.
And
so.
this might be because forensics, right? So we know there's a scientific something.
Right.
And people want to know exactly what is it.
Right. And so we do a lot more testing, I think, than we ever have.
Interesting shift.
Yes. And then it comes to the discussion of vaccination, which, we can get into, where we have always talked to our patients about vaccination. And I think we saw more patients really seeking vaccination soon after, the pandemic in 2021, 2022. But in many ways, that's actually decreased more recently. And we're not seeing as many, patients seek out flu vaccination as they had been maybe in a couple of years ago.
Because there was a higher, maybe a fear at that time. Let's talk about Tamiflu, because really it's become synonymous with flu treatment. When should someone take Tamiflu, or are there situations where they should avoid it altogether?
It's a great question. So I talk to my patients about Tamiflu a lot because I get asked that question, frequently during the flu season. And the best way to answer it is to first, make sure everyone understands that Tamiflu is an antiviral medication. And what it does is that it helps decrease the severity and duration of your symptoms. So if you're a young, healthy person, it's not necessary that you need to take Tamiflu to cure yourself of the flu virus. The other thing about Tamiflu, it's also very time sensitive, meaning that you need to take Tamiflu early in your illness. And if you have flu symptoms in the first 24 to 48 hours, Tamiflu is a good choice if you do indeed, start taking it, because it can help you. But if you're later in your illness, that, day 5, day 6, a week out, you're not going to get much benefit from taking Tamiflu.
So it sounds like patients really are more educated. They want to know which strain they have. They want to have testing, and they're even asking for medications. Do you find that patients are more knowledgeable now, have more information?
I do. I think there's a lot of resources. I think that patients, in the past would, have these respiratory illnesses and maybe just brush them off and go about their daily, activities. But now they are more inclined to maybe stay home. They're more inclined to seek testing and really try to identify what's going on and how they're going to, get through it.
Okay, getting back to the flu vaccine, how is it developed? That's a question so many people want to know. How do they determine exactly which strain to select? It's
very interesting. I mean, getting to a flu vaccine every year that, we can go and as a patient and take is a really a monumental effort. So what we know is that, globally, it's a big collaboration amongst many countries around the world to identify the different flu viruses. And they'll really try to do that before the flu season starts. And because the flu itself as a virus has the ability to really mutate and change, what this sort of process entails is taking all these current flu viruses from that given year and try to predict what the future strains will look like, and then try to develop vaccines that will target those future strains. So there's really as I mentioned, a big effort to try to determine that by really, the meeting of scientists and researchers across the globe. And this really runs through the World Health Organization and more, in our country, the Center for Disease Control. But the idea behind it is to be able to identify those strains and then to be able to produce, purify, and distribute vaccines to be able to provide a vaccination, for the upcoming flu season.
In a timely manner. What
Correct.
A challenge. It's not a small feat.
Absolutely not.
Okay, so let's talk about different flus, right? So what's the difference between flu A, right, and flu B? Are there different symptoms? Are there different way that they manifest in us?
The symptoms are somewhat similar. The big difference is flu A is a type of flu virus that you'll see more in like adults and animals. And it's something that you'll see more in like elderly patients, we find, as well as it's a type of flu virus that is going to be more common when we, see like a flu pandemic. Whereas flu B, you're going to see more in your children and your teens, younger, healthy people. And it's more seasonal. And it's in some ways can target that patient population more.
So would it be possible to get flu A, say, in the fall, and then flu B later on? Are you still at risk? Does that happen? Does that equate?
It's definitely possible. You can, it's not common, but it's definitely possible because they are not, identical. And so a patient can actually have, both either flu A or flu B, although we rarely do see that though.
So sometimes we see people that test for the flu and the result is negative. Then 2 days later, they get the flu or they have the flu or they had the flu. Let's talk about timing on the testing or timing on receiving the vaccine.
Well, from a timing standpoint, there's an incubation period. So the flu kind of incubates from anywhere from 1 to 4 days. And in the early part of that incubation period, you may not have symptoms. And actually, because the virus does not replicate as much early on, you may actually test negative even though you have contracted the virus. So from an early on standpoint, you can actually be someone who is contagious without necessarily, having symptoms yet. As you kind of go through, up to day 2 to 4 is when you'll start getting symptoms. And as the virus starts replicating, that's when you're going to probably start manifesting those symptoms and, probably test positive if you do indeed have the flu virus.
So this gets really tricky for children. What is the typical incubation period for kids? And how does a parent make a decision whether or not to send them to school or to kindergarten or to daycare? Is there a way to be able to time that? Or you're looking at me as, I don't know.
Well,
I guess it's a little bit of a guessing game.
I'll tell you, when it comes to a parent making that decision, we all know parents really want to get those kids to school or back to school. But what we advise is we let them know, one is that, even a child can spread the flu early on without having those symptoms. But at the same time, when flu symptoms do present, the real most important thing is that the child should really go back to school or back to daily activities when, they've reached that later onset of days, day 7, and they don't have fever anymore. They're not taking medications for fever, as well as they sort of feel like they can do their activities that they normally do without too much, fatigue or exhaustion.
But on the front end, a lot of people say, well, I feel fine, so I must not be contagious. Is it possible to be contagious and not have symptoms?
It is, because in the early onset of the incubation period, that day 1, 2, you may not have symptoms, but you can be contagious before you present or manifest, those obvious symptoms that make you feel, that headache, fever, malaise, body aches that are so synonymous with the flu.
When does the flu season officially begin? And is it different for us here? Because in South Florida, it's warm all the time. So we might feel like we're never going to get the flu season, but we certainly know that we do.
We see things a little bit differently here, but traditionally, flu season really will kind of start in October and then peak sometime between December and February, depending on the year and the strains. In like warmer climates, we may see things that are a little bit earlier or even later extend. So it gives us a little bit more of a, increased time where we have to be a little more vigilant for surveillance. But in general, it's those months, between October to December, maybe even through February, that we'll see the peak season of flu.
So when do you think is the best time to get the vaccine?
So with vaccines, you don't want to get vaccines too early because they don't, provide protection forever through the season. But you also don't want to get them too late because you need some time for your own immune system to build up that immunity to the flu. So we kind of recommend for most patients to get the vaccine sometime in the month of late September through late October. And from that point, you're going to give yourself enough time to develop the antibodies you need that the vaccine can provide, and then sort of be ready for that potential peak season of the flu.
And do you recommend waiting until January or trying to hit that midpoint? Is there a sweet spot or late September, early October?
I recommend those months for most patients, but if, we always say it's still never too late, because if you can, get yourself a flu vaccine and you don't get it during that time and you can get it later in the season, it still can provide some protection. We also want to advise not to also get the flu vaccine too early, because we don't want it to wear off right before peak season and you don't have that type of protection.
And what determines that peak season? Is it really that is it because we're being more social because it's the holidays? Does that make it peak season? Or is it because the virus itself tends to replicate?
We look at things that are, like you said, gatherings, the holidays, travel, which is a big time during that year. And then we also see changes of weather. And so I think a combination of all those factors really, determine peak season. And so we have good evidence to be able to determine when those peak months are. And we look at, not just the current year, but years past to help with those trends. And what we find is really during those winter holiday months are really the time where we're seeing the biggest increases in the numbers of patients testing positive for influenza.
A lot of people say, it's the flu. It's just a really bad cold. I'll be fine. Is there a difference medically?
Flu is very different than the common cold.
Is it?
Yeah.
I mean, it feels different because I know your body hurts.
Yeah. I mean, most patients that have the flu will tell you that, the symptoms are very abrupt. There's high fevers, body aches. You can get headaches. Some of these strains even can provide you with symptoms that are more intestinal, like vomiting and diarrhea. So it's definitely a more intense illness than just the common cold.
And so it's better to treat it, or is it possible to just ride it out?
I think it depends on your own symptoms and, your own medical history. Patients that are older, that are more vulnerable, like greater than 65, will be more vigilant to treat. Also patients that are very young, like young children, as well as patients who are pregnant or have other chronic conditions like asthma, heart disease, cancer. Those are the type of patients we really want to, be a little bit more aggressive about diagnosing and treating, because those are the patients that can actually have more complications.
And when we speak about complications, is there a case where it could be deadly?
The flu virus still has a lot of patients who unfortunately, can be, so sick that they require hospitalization. Mm-hmm. And there is some mortality associated with it. And it depends on season. So, it could be upwards from a light year of 10,000 patients in the United States who died from the flu, or a heavy season, which I think the most recent heavy season was the 2017 to 2018 season, where almost over 50,000 patients, were actually killed from having the flu virus. So it really depends on the year, but it's definitely something you have to take seriously, especially in those more vulnerable patient populations that I mentioned.
Education. That's why these conversations are so incredibly important and empowering for people who are listening to it. One of the myths that we hear all the time is that if I get the flu vaccine, I'm going to get the flu. Can you clear that myth up for us?
Yeah, there's not an association between getting the flu vaccine and getting the flu. And the reason why is because when patients get the flu vaccine, it's a particle of the killed virus and it doesn't replicate like the flu in your body. It may be associated with some soreness of your arm, maybe some body aches for a day, a possible low-grade fever, if that, but nothing that would resemble anything specific for traditional flu-like symptoms.
Another thing I hear, and I know it's a misconception, is someone has the flu, but yet they take antibiotics. So obviously it's a virus, and antibiotic is clearly for bacteria. Is there a case where an antibiotic would be recommended for someone that has a flu? Is there any kind of symptoms that it could treat?
It's important for patients to understand that antibiotics do not treat the flu. And so we really try to educate our patients to let them know that, for this particular virus, it's really not beneficial to take those antibiotics. Now, that being said, there are instances where sometimes you can have a secondary bacterial infection, like in your ear or your sinus, or possibly another type of bacterial pneumonia that can be associated. But for the most part, most patients who have influenza do not need to be on any antibiotics.
So the antibiotic is going to make you feel better from your flu symptoms.
Correct. And
unless, as you said,
and there's risks with taking antibiotics. So, antibiotics can cause increased resistance. They have side effects, and they're actually not great for your, normal flora of your gut. So you don't want to necessarily take these antibiotics if you don't need them.
Another thing that people say very often is, I got the flu shot last year. Do I need it again? So is it important to get a flu shot or a flu vaccine every year?
It is, because the virus mutates. And so there's different strains. And so the vaccine really tries to target the upcoming strains, and you can lose your own immunity from the prior year's vaccine. It wears off. So we do encourage, our patients to get the flu vaccine annually to try to target those upcoming strains that we predict could be, the current season's flu virus.
For anyone that's on the fence about getting a flu shot, what's the one thing you'd want them to know?
I think that we see that, patients think that they don't necessarily need the flu shot, but it's not just about, you, it's about, the people around you too. So you want to really look at getting the flu vaccine to protect yourself, but also protect your loved ones, people you're around that you encounter that may have weaker immune systems, that may be older in age, that may be younger and more vulnerable. So we have to kind of have an approach that, takes it from like me to we. And so that's a really important point when you get the flu vaccine, that it's really about protecting our community and not just yourself.
And then I wonder, what does it look like for someone? Like, how would it manifest? How does the flu manifest on someone who chooses not to take the vaccine as compared to someone that did get protected?
A flu vaccine can really protect you from getting the flu. But even if the vaccine doesn't target the current strain, which sometimes happens, it can definitely provide you a more diminished, course of illness. And so it's been shown to do that, which has been great because your symptoms may not be as severe and they may actually also be shorter in duration. So it's a good thing to take the flu vaccine and, have the trust in the actual, process of taking it, because it can only help you protect you from the current flu, or at minimum, give you some benefit if, you do catch a flu and it's not the actual correct strain. So it has a lot of benefits.
And they're readily available. It's easy to get a flu shot, right?
Yes.
Just go to a CVS or a Walgreens or...
there's so many avenues of where you can get a flu vaccine. And, as a healthcare worker, we actually are very much, vigilant about making sure we are vaccinated as well.
Okay. This has been a fascinating conversation. Thank you so much. I know that it's going to be extremely powerful for people who heard all this information. And I think we cleared up a lot of things that were myths and misconceptions and things that I learned that I didn't know about before. So thank you so much, Dr. Mishkin. It was wonderful. Thank you for sharing this insight with the audience. And viewers, remember, be sure to hit the subscribe button on our channel right here to keep up with the latest health and wellness information and tips from our experts. Thank you for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.